Well, millions of Americans suffer from something that could take part of their eyesight away.
We're talking about macular degeneration, and we've asked Dr. Brian Berry, Medical Director of the Grand Rapids Eye Institute, to come talk to us about prevention and treatment.
That's right. We hear a lot about macular degeneration in the media, but what exactly is it?
Macular degeneration is a disease that affects the back part of the eye, the retina, and specifically a small part of the retina called the macula. And the macula is responsible for everything that you see directly in front of you, for your clear vision, your 20/20 vision. And when that's affected, it starts to turn things blurry. And if it's real severe, then what happens is that items or people become unrecognizable.
Okay, so that's how someone might know if they have it. I mean, are there little sneaky signs that you start seeing little indications? Because
unfortunately, by the time patients start to notice signs, it's fairly well advanced.
Really?
So the best way for patients could just come in for an eye exam, and we can spot it on an eye exam through a dilated eye exam.
Oh, okay.
And then once we see it in the back of the eye, the very early forms, we have very sophisticated machinery now, or an instrument, take a picture of the eye, and it can give very detailed picture of what it looks like, and we can very closely follow its progression.
Okay, that's amazing. And what are the risk factors? Or is this something that just normally comes with aging, or are there certain things
that
happen?
It's not normally. Not everyone gets it. There's family history. That's probably the biggest thing that people will have it. And there's a whole list of things that you can get.
Okay.
Well, I'm interested in hearing about prevention. I mean, are there some things that we can do to prevent from having this impair our eyesight?
Well, as far as prevention, there are several things that you can do as far as preventing it. Diet is very big. Maintaining normal body weight, eating leafy greens, as well as taking vitamins. There are certain vitamins that can certainly help.
So if a patient presents for an eye exam and you spot this in your practice, what's the type of surgical procedure that you would do for that person to save their eyesight?
Initially, there's no surgery. Initially, what we want to try to do is get it early and prevent it from getting worse. So you'll talk to them about using a little grid to monitor their vision, make sure that they come in for their normal eye exams, talk to them about diet, especially if they smoke, they have to stop smoking. When we see them, we'll put them on a vitamin, and if they do need intervention, then there's several things that we can do. There's injectables, there's lasers, and there's an implantable little telescope. It's been approved, but it's not available yet.
Okay.
What do you hear from patients about, getting this treated and the importance of it and how it's able to really change their life in a better way once they are able to treat this?
Well, as far as macular degeneration, what happens is, the biggest concern that patients have is they can't see their children. They can't see their face or their loved ones. So that's why we tell them, the earlier the better.
Okay, because once it progresses...
Once it gets to a certain point and it's not treatable, then we can't get that vision back.
Okay, and so if somebody's interested in getting an eye exam, they can easily get in touch with you. Your office is so easily located.
Yes, it is. It's right on the corner of Burton and East Paris. And they can reach us on the web at grandrapidseyeinstitute.com, and that's by far the easiest way to get
and you're on Facebook.
And we're on
we
Facebook
love Facebook.
as well.
And so do a lot of our viewers,
really great.
too.
Yeah, and your staff is fantastic, and I know, Dr. Berry, you did my LASIK eye surgery several years ago, and there's nobody I would trust with my vision other than you. So if, again, there are viewers who may be concerned about macular degeneration, certainly give Dr. Berry's office a call.
Yeah.
Yes, thank you.
Thanks for being here today.
We'll be right back.
That's West.